Okay, going to external carotid artery. So the external carotid artery, it usually begins as bifurcation of the common carotid artery. So you have here, this is the common carotid artery, like that. So there is a bifurcation at the level of C4 and then ascends up in the neck just to anterolateral to the internal carotid artery. So this is the internal carotid artery. So to be anterolateral to the internal carotid artery and end in the substance of the parotid gland by dividing into two terminal branches, the maxillary and the superficial temporal branch on the other side. Okay, so you look from below as well, just to specify one thing that we explained before. So you will have from here, that will be the brachiocephalic artery coming from the aortic arch, and will give two branches as you see. This is the subclavian artery, right subclavian artery, and then the other side, this is the right common carotid artery. Remember we mentioned the thyroid gland blood supply. We mentioned superior thyroid and inferior thyroid. So this is the inferior thyroid coming from the first part of subclavian artery. So this is the subclavian artery, first part of subclavian artery there, and moving all the way up through the inferior thyroid artery like that. So this is the thyrocervical trunk. Okay, great. So we mentioned as well the superior thyroid artery. So this is the external carotid artery. So the first branch that comes from it is the superior thyroid artery. Okay. So there is another question asking about the branches of the external carotid artery. The way I prefer to classify these branches is branches from the anterior surface of the external carotid artery and the branch from the posterior surface of the external carotid artery and the branch from the medial surface of the external carotid artery and two terminal branches. So let's talk about the anterior surface. So the anterior surface will give you the superior thyroid artery, like we said, this one, superior thyroid artery, and will also give the lingual artery and the facial artery as well. So facial artery, it's the last branch from the anterior surface. It takes a tortuous course on just the lower border of the mandible, very close to the masseter here. When you try to palpate it, you will palpate it in this area, the inferior border of the mandible, just anterior to the masseter muscle, and it makes lots of collaterals and lots of anastomosis with the artery on the other side and the maxillary artery as well. Okay, two terminal branches, we mentioned them, the superficial temporal and the maxillary artery. And posterior surface, you have posterior auricular and occipital nerves. So this is occipital and this is posterior artery, sorry. This is posterior auricular and occipital. And you have ascending pharyngeal, which comes from the medial surface. You have around like 7 branches. Might sound a bit difficult to remember. However, it's easy when you classify it into anterior surface and posterior surface and medial surface and terminal branches. Okay, so there is a nerve related to the external carotid artery, which is the hypoglossal nerve. Okay, there is another question now asking about something called carotid sinus, carotid body, and carotid sinus. So carotid body is a chemoreceptor. Carotid sinus is a baroreceptor. From the name, chemoreceptor means it responds to change in the pH. So when the pH is low, so that is acidotic, it will stimulate the respiratory system to wash out carbon dioxide. The baroreceptor, baro means blood pressure or mechanoreceptors. So when there is hypotension in sepsis patients or hypovolemic shock, so the key baroreceptor will lead to production of vasoactive substance to lead to vasopression of the arteries. Okay, so these are, okay. But what are the anatomical value that the carotid body is present on the upper end of the common carotid artery, just right there on the posterior aspect. Carotid sinus on the lower end of the internal carotid artery and the upper end of the common carotid artery. So these are its anatomical value or anatomical significance. All right. Well, facial artery palpation, like we said earlier, on the inferior border of the mandible, very close to the masseter muscle. So just right there. So this is for facial artery. Well, there's another artery as well on that area that will be superficial temporal artery, which is one of the two terminal branches of the external carotid artery. Obviously, this is the parotid gland, and we mentioned it early, and this is the parotid duct.